Welcome to day 1 of the 30 days therapy exercises for joint pain, and this is all encompassing coaching program. So it starts with how you wake up in the morning. How do you wake up in the morning? So it starts with your sleeping posture. How do you sleep? The reason why a lot of people feel pain in the morning is because they sleep with the wrong sleeping posture. So it affects different areas of their joints. So it starts with the mattress that you are using to sleep. You should use a semi-orthopedic bed or an orthopedic bed. Now, if the mattress you are using sinks, in other words, if you sleep like this, and you discover that the weight, especially in your lower back area here, your mattress sink inside, then that mattress may not be good again for you. So it can be causing back pain for you over time. So you may need to change it to semi-orthopedic bed or a full orthopedic bed. All right. So what are the right sleeping posture you should take when you want to sleep so that you don't wake up with excruciating pain in the morning? But it starts first with wrong sleeping posture. What are the wrong sleeping posture that we have? The first wrong sleeping posture, especially if you have pain, is to sleep on your tummy. Okay? When you sleep on your tummy, why is it wrong? Now look at me. When you sleep on your tummy, you affect because you turn your neck like this, it affects your cervical spine most of the time. So it is not always good, and you put a lot of pressure on your internal organ. So if you are already dealing with pain, you should only sleep with your side and with your back. And there are rules to this. So let's start with back sleep. Now, the kind of pillow you use when you sleep really matters. So we advise you to use fiber pillows, not the kind of pillows that they put foam inside. You should use good fiber pillows, and fiber pillows are in different sizes. Now if you look at this, you will see that this is bigger, is fuller than this, but it does not mean that this is better than this. It depends on what you want to use it for. Now, the kind of pillow you put on your head, I think I will start with side sleeping. Now, let me use this big one first. If you put this pillow like this, and I sleep like this, okay, what is happening is that this pillow is not putting my spine in a neutral position. Why? Because it is twisting my head upward like this, okay? So, when I wake up in the morning, over time, I may be feeling pain here, okay? It may even run to my lower back because I'm putting a lot of pressure on my spine. In the same way, some people will say they don't like to sleep with a pillow. So if you don't sleep with a pillow, it's also not good because this is how your neck will be. See, look at it. See, this space here will cause you pain over time, all right? It will cause you a lot of pain over time. So you should use a pillow, a soft fiber pillow like this, that will allow, let me show you, that will allow that will put your spine, your cervical spine in neutral position. Let me explain what it means. It means that it must be straight like this. It must not tweet up like this. It must not tweet down like this. It must fully align like this. Also, always remove your shoulder when you want to sleep. Don't sleep on your shoulder. Many people experience shoulder pain. Why? Because they sleep on their shoulder. Many people are not conscious of it. Some people sleep like this. Okay. They put a lot of pressure on their shoulder. So always remove your shoulder. See the way I'm removing my shoulder. If you are somebody that like to hold a pillow, you can hold a pillow like this, while you sleep. But another thing also is that when you are sleeping with your side, you should always put a pillow in between your leg like this. And why? I will tell you certain reason. Now, especially for people that are overweight, you see, when you sleep like this, especially if you are heavy here, you have a big lap. You rest this lap on another one. You see, this joint here, if you rest it for too long, it will grind each other over time. It will cause a lot of pressure. And so you should reduce the weight. It's like you are bracing it like this. You see, you have cushioned this place. And it will also help your lumbar spine as well to be in a neutral position. Another thing that you should always do also is that you may not need a pillow for this. You may get clothes that you want to double like this. And I want to use a towel. I think I might have to use two like this. Okay, so you want to put it within your lumbar spine area here when you sleep. So you are using the right pillow on your head, then you are using a pillow to support here. Can you see? I'm supporting here like this. Okay, then you want to put a pillow like this. So this is how to sleep. So remove your shoulder. Don't sleep on your shoulder. Then you are good to go. You may put your hand there. You may sleep anyhow you like. Now, what of in the midnight when you are not conscious? You have turned to the other side. So let's say you have turned like this. Okay, you can also sleep like this. Now, when you sleep like this, you should also use a pillow. It's the same rule. Use a pillow that will not make your head to be like this, or make your neck to sink downward like this. So it must align like this. So use a soft fiber pillow. If you buy the big one, you may need to remove some fiber from it, and tack the mouth again. Just make sure that your spine is straight. It makes your head to flush with your body and make it straight. Okay, so like this is okay. All right, so you should also put a pillow at the back of your leg like this. So it will create a small hollow. So it will reduce the pressure on your lumbar spine. Always put a pillow like this. Then you can also support with a soft cloth like this. You can double it. I like it like this. You will see that it will fully cushion my lower back, and you are good to go. So it starts with the right sleeping posture, so that when you wake up in the morning, you don't wake up with pain. Then how do you stand up? Because these things are important. How do you stand up when you have slept over the night? So it is a wrong posture to stand up like this. You see, many people stand up like this. So you are putting a lot of pressure on your back. Okay, so some people just stand up anyhow. No, the way you want to stand up is you want to stand up by the side. So let's assume that this is your mattress. Okay, you want to stand up gently like this. Okay, you want to. Sometimes some people's legs are heavy as a result of arthritis. So you want to support with your hand like this. Okay, then just see the way I'm standing. Then support with your hand and stand up gently like this. It is very, very important. Now, that means that when you want to go and urinate in the night, during the course of your sleep, you want to stand up with the right posture. Another thing is that when you want to wake up in the morning, before you start your day work, you should quickly do what we call warm-up exercise or pre-therapy exercise. This is a little exercise you do before you start the main exercise. Now, let me explain to you. So, let's imagine that I sleep in this position and I'm just waking up in the morning. Don't just stand up like that. So, what you should do is that you should do a little warm-up. Okay? For any kind of pain you are feeling, just do this little warm-up. Okay? Just your leg like this, do it like this. Okay? Then release it. This is simple range of motion exercise. Okay, release it. Just do 5 of this. Okay, then you do 5 on this side. You do 5 on this side too. It is perfectly fine. Then you can do like this also if you have lower back pain. Before you stand up, okay, just hold it like this. Then try to bring it to your chest like this, just for 5 seconds. Then you can release. So you can do that one 3 times. Then you stand up the way I asked you to stand up. You bring your leg like this, then you stand up like this, gently like this. Then, even while you are sitting like this, before you start, you can just stretch your leg like this. Okay, give it some range of motion. Because motion is illusion. You always want to be putting your body in a full range of motion. Then we'll move to another thing right now. We are moving to another segment of this training.